Hello, everyone. Thank you for joining us for this Keystone Symposia ePanel discussion on the impacts of climate change and human health. I'm Thale Jarvis, Chief Scientific Officer at Keystone Symposia, and I'd like to welcome you to this event. Keystone Symposia has a long history of programming outstanding events in the life sciences, largely focusing on the underlying molecular and cellular mechanisms that drive fundamental biological processes involved in health and disease. This ePanel is a collaborative initiative with the Global Consortium on Climate and Health Education. This is part of a series of virtual events focused on specific aspects of climate and health, and arises from a broad recognition that climate change is a growing contributor to a variety of health-related concerns, from air quality and respiratory health to infectious disease and heat stress. We also recognize that these health impacts fall unequally across various populations, raising concerns about health equity and the need to build resiliency in our healthcare systems to address systemic inequities arising from climate change. This ePanel series is part of a larger initiative at Keystone Symposia to lower our carbon footprint and democratize access to compelling scientific content through an expanding offering of virtual content. With that, I'd like to welcome Cecilia Sorensen, the Director of the Global Consortium on Climate and Health Education.
Hello, everyone. Good morning, good afternoon, and good evening. We are delighted that you are joining us here today for this ePanel series on climate change and health. My name is Cecilia Sorensen, and I am the Director of the Global Consortium on Climate and Health Education. Our mission is to ensure that 100% of health professionals globally have the knowledge and skills to prepare for and respond to the climate and health crisis, as we know that impacts are already happening and affecting the most vulnerable patients and communities globally. The GCCHE was founded in 2017 at the Conference of Parties in Paris, and today has grown into a vibrant community of over 300 health professional schools from 50 different countries, all who have pledged to train their students in climate and planetary health. We represent schools of nursing, medicine, pharmacy, public health, social work, dentistry, and veterinary medicine. We are so delighted to be partnering with the Keystone Symposia to bring you this ePanel series on climate change and health, where we bring together experts from around the world to tackle some of the most pressing challenges of our time. Together, our communities have the opportunity to bridge the gap between scientific research and clinical and public health practice, to bring to the forefront collaborations and solutions where they are needed most. So we hope you will join us for the networking session after this event as we continue to build this exciting partnership. Additionally, we invite you to explore our masterclass series, where leading experts in climate and environmental health discuss emerging research and the scientific basis for this work. So thank you for joining us today. We hope you will enjoy this discussion and look forward to working with you.
Hello, folks. Welcome to today's ePanel event on climate change, air quality, and lung health. This is the second event in a series of ePanels focused on different aspects of how climate change impacts human health around the world. I'm Patrick Kinney, the Beverly Brown Professor of Urban Health at Boston University, where I teach and do research on the health implications of climate change. I have the honor and privilege of moderating today's ePanel discussion. As we've heard already, climate change is posing a wide range of risks to public health, from extremes of heat to intense storms and floods, to food insecurity, infectious diseases, and other pathways. Today, we focus on how climate change interacts with air pollution and related health impacts. Air pollution is a global challenge, both indoors and outdoors. Air pollution results largely from burning of fossil fuels like coal, oil, and gas, but can also arise from other sources. We know how much it takes to control air pollution. We've been quite successful in rich countries like the US over the past 50 years or so in improving air quality. However, developing countries are now confronting the air pollution burdens that have accompanied their industrial development, as well as the impacts of burning smoky fuels indoors for cooking and heating, which is still common in lower income countries in Africa and Asia. Air pollution and climate change are intimately connected, as we'll hear today. Many of the same sources that pollute our air also emit the greenhouse gases that are the main drivers of climate change. As climate warms and air pollution changes and weather patterns change, air pollution can be made worse through the changes in chemistry of the atmosphere and also the transport of air pollution. especially for ozone and fine particulate matter, two air pollutants that are especially harmful to human health. In today's ePanel, we'll hear from 4 experts who will discuss how climate change is making air quality worse, the unique health implications of wildfires, what we know about mechanisms by which climate interacts with air quality to cause lung disease, the policy options that can help to mitigate these health risks, and many other related aspects of this complex problem. Our discussion will emphasize the urgent need for bold and immediate action to address climate change and the many health and equity benefits that can be achieved in the process. And now I'd like to welcome our panelists. Susan Annenberg is the Associate Professor of Environmental Health and Occupational Health and the Director of the Climate and Health Institute at George Washington University. Irva Hertz-Pitzkioda is Professor of Epidemiology and Professor of Environmental and Occupational Health at the School of Medicine at the University of California, Davis. Kari Nadeau is a Disney Foundation Professor of Medicine and Pediatrics at Stanford University and is the Director of the Sean Parker Center for Allergy and Asthma Research at Stanford University. And finally, John Balmes is Professor Emeritus at the University of California, San Francisco and Berkeley, and is a physician member of the California Air Resources Board. I'd like to thank you all for joining us today. We will begin by having each of our panelists give a brief overview of their work and expertise, and then we'll follow that by a panel discussion and live audience Q&A. You may submit your questions for the panel at any time into the Q&A box and vote on other people's questions that you would like to hear answered. And as the discussion progresses, I will select questions to pose to the panel. Thank you.
Hi, I'm Susan Annenberg from the George Washington University. Thank you for being here today. I'm really looking forward to this panel. Climate change is a defining public health challenge today and throughout the 21st century. We are already seeing climate-induced changes in wildfires, extreme weather events, and heat exposure, affecting a range of diseases like respiratory disease, cardiovascular disease, and mental health across the country and around the world. Climate change is expected to increase public health risk through a variety of ways by increasing heat-related mortality, extreme weather events, waterborne disease and tick and mosquito-borne disease, and worsening air pollution from increasing ozone, wildfire smoke, and airborne dust. These problems are affecting people in diverse ways, with communities of color and those with lower income and educational attainment levels being harmed disproportionately. What's worse, these risk factors can compound. We're seeing more COVID exposure and worse COVID outcomes for communities exposed to wildfire smoke. When heat and air pollution happen concurrently, we can expect more visits to emergency rooms and hospitals for respiratory symptoms. The combination of multiple stressors worsening under climate change and affecting people at the same time means that we need to anticipate multiple events simultaneously and plan healthcare resources accordingly. While climate change is increasingly capturing the public's attention, its impacts on public health are often overlooked. But bringing a health lens to the climate problem is not all about shining a light on the health damages of climate change, although that is critically important. Many actions to reduce greenhouse gases by avoiding fossil fuel combustion will also lead to other societal improvements, like for air quality, public health, equity, and natural environments. While the effect of reducing greenhouse gases on the Earth's climate is globally diffuse and takes centuries to unfold, the environmental and health co-benefits can happen immediately and locally. These additional societal benefits of actions that reduce greenhouse gases can also be persuasive in changing the lens through which people view climate change mitigation. This is particularly the case as a public health frame and positive and hopeful messaging can be more motivating to action compared with a focus on costly risks. Our options for addressing the problem through governmental action at the national scale are narrowing, given the lack of legislative action within Congress and the recent Supreme Court decision in the West Virginia versus EPA case, which limited EPA's authority to regulate greenhouse gases. I was pleased to join with the American Thoracic Society, American Medical Association, American Academy of Pediatrics, and other organizations and leaders of the US medical and public health community in writing an amicus brief for the Supreme Court case, that describe the public health rationale for national policies to mitigate greenhouse gases. I'm really energized to see more and more people who work in the health sector engaging on climate change, whether it be talking with their patients about how they can avoid unhealthy consequences of a warmer planet, researching links between climate change and health effects, or advocating for policies that would make us healthier and more sustainable. We really need all hands on deck to address this health emergency. Thank you so much for being here, and I'm really looking forward to today's discussion.
Thank you to the organizers for inviting me to this panel. Here's a graph of the rise in global temperatures over the last 140 years. It's become fairly steep and obvious for the last 40 at least. And it still leaves out, however, the millions of lives that have been lost as a result of these changes in global climate, and also trillions of dollars in damages. Now, as a footnote, I just wanted to let you know that back several decades ago, in 1985, early in my career, I was a co-author on the first paper ever to look at climate change and human health, to my knowledge. It was part of a Department of Energy project, and we, even though the warming trend was maybe not obvious to many people, it was the evidence was there, and of course we know a whole lot more now. These are the many faces of climate change, and you're familiar with them: drought and storms and permafrost and Texas ice and windstorms. I'm going to be focusing on wildfires, which are naturally occurring, but the mega fires are not. In fact, nature self-regulates, and fighting fire with fire, so to speak. And this is really how indigenous people have been working with fire for thousands of years around the globe. And their fire control strategies have been much more successful than the colonial settlers. So there's a lot to be learned, and there's some really interesting recent examples of successes in that realm. Now, fires produce extremely high particulate matter. This is taken from the Paradise fire, where this town that was destroyed in 2018. And this is a graph of the levels of particulate matter, 2.5 in that time period of the fires. Very high levels, into the hundreds, above 400 even in some days. The composition of wildland fire smoke is still not understood, although we do understand that some of the health effects from studies in firefighters are clearly in the area of lung function and mental health. We also know that studies in the general public show some of the same outcomes, and that other outcomes, there's simply just not enough data to really know what's happening in other systems. And there are virtually no long-term studies. We launched a longitudinal study called What Now, California, but I'm not showing you the longitudinal data. This is just data during the 2017 fires, where more than 20% of a cohort of many thousands of people were experiencing asthma or wheeze, and over 50% minor respiratory symptoms. I'd like to draw your attention to the problem of multiple disasters. And I think this is something that's going to be happening more and more. We need to ask, are the effects additive, or might they be synergistic? Also, in regard to multiple episodes where, for instance, wildfires return to some of the same fire-prone communities year after year, how are those health effects different from simply the single episodes? Susceptible populations, I think other speakers are also going to be talking about susceptible groups. Clearly underserved, marginalized people of color, Blacks, Hispanics, Indigenous, and immigrants and multiracial groups have long had problems, disparities in health that are exacerbated. In fact, disasters, one thing they do is that they exaggerate the health disparities, and they seem to grow with every disaster. So that's a serious problem. And then the vulnerability can actually take a lot of different forms. There's a lot to unpack. Certainly this vulnerability during an acute disaster, for instance, evacuations, will affect people with physical disabilities or mental health conditions. And then there's the issue of long-term effects and how disparities look in the months and years after a fire. Suggested research really needs to happen in the area of what's in wildfire smoke and composition, what kinds of toxicities are there, and understanding the health risks. Again, multifaceted. How can we holistically address the health of individuals and of communities? Why do mental and physical health problems tend to co-occur, certainly around disasters? And how can we really dismantle those institutional structures that just replicate and amplify disparities in the light of climate change? In 2018, the WHO issued a special report calling on health professionals to step up to the plate on climate change and health effects. And they gave many reasons and ways in which health professionals can be key influencers, in part because they are trusted more so than many other groups. So there's educating the public, educating the media, government officials, and helping to develop strategies for health protection. My final slide, what can we do? It's easy to feel despair and to feel completely overwhelmed by this problem, but there is more than you think that you can do. And there are individual changes that you can make. There are actions you can take at the level of member of civil society, working with local initiatives, around climate mitigation and expanding public transportation, or installing solar panels, creating green spaces. And then as a professional, there are actions that you can take. Certainly the health sector is a major contributor to greenhouse gas emissions. So there are a lot of ways that you can decrease the footprint in terms of influencing your own employer, conducting research, testing out interventions, getting your professional society to weigh in, and developing curriculum or teaching a course. There are resources plentiful all over the web. So that's it. Thank you very much.
Hi, my name is Dr. Kari Nato. Thank you so much for inviting me here today. I'll be talking about climate change, lung health, for this wonderful Keystone ePanel on air quality and lung health in terms of micro to macro. So from the molecular to the macro epidemiological findings. So I think a lot of you already know that the effects of air pollution and climate change are increasing. They affect all parts of the body. What you can't see or smell could actually harm you from air pollution. There are many different types of sizes and toxicants in air pollution, as well as that pollution affected and increased by climate change. For example, there are effects on the skin, the lung, premature deaths and births, systemic inflammation. There's a lot of effects overall on the immune system, which is what I'll be talking about today. Importantly, with increasing extreme weather events that are associated with climate change, that's increasing mental stress and mental health issues in all ages. And that results in PTSD, or post-traumatic stress disorder. Stress in terms of displacement and loss can oftentimes increase and compact the issues around climate change and air pollution exposure. In addition, longitudinal analysis has shown that there are increases in lung cancer deaths as well among adults. But importantly, what are the effects of air pollution and climate change in the most vulnerable? Well, I focus research on children and pregnant women. And importantly, when you look at the recent World Health Organization air quality guidelines, you see that a lot of the children and pregnant women in the world are living in conditions that far exceed the World Health Organization's PM 2.5 levels in their guidelines. And importantly, when we try to understand the microscopic, the molecular changes that are associated with air pollution and climate change and stress, for example, we can actually look at the genes of someone and we can look at that in their blood. And particularly when you saw the list of the health outcomes associated with air pollution and climate change, a lot of it does exist in the immune system. And so that's what I study in my laboratory and research team. We look at the immune cells, which are pictured there, because when pollution or when chemicals expose the human body or stress occurs, you can see these changes in the DNA of the fabric of our DNA is then modified. And we can look at that not only in that particular person, but also in their progeny. And so studying the effects of ambient air pollution and climate change during pregnancy and childhood is especially important since these are the individuals that are very vulnerable to climate change and air pollution. And so, for example, we study with collaborations with John Baums, who's here today. We have a project going on in Fresno, California in the Central Valley. And with that, we've been able to assess, thanks to our collaborations with colleagues at UC Berkeley, that where are the most potent changes in air pollution throughout our state in California. You can see in the hourly air quality indices there, combining PM and ozone. For example, in 2018, you see a lot of areas in California affected not only by air pollution associated with diesel exhaust emissions, but also wildfires. And wildfires in our state, especially around the world, are increasing because of land use management issues, as well as climate change and other parameters. So you can see there in our demographics of this population, we're looking at pregnant women, but also importantly, these are women that represent minority populations that are vulnerable and that have been associated with redlining and red zoning due to people of color and a lot of discrimination practices, unfortunately, in our country. And with that, we've been really focusing on environmental justice as to what to study and how to help these individuals. So just quickly, I'll talk about the results of that study, which is currently ongoing as well. We have shown that methylation levels in specific gene loci like interleukin-4, IL-10, and interferon gamma, these are important genes in inflammation and in allergies and asthma, and that they're associated with these pollutants, unfortunately, and they're sustained over multiple periods of time. We also showed changes in their immune cells and their immune system, and these results offer insights into how air pollution, especially now including wildfire smoke exposure, affects the pregnant woman during pregnancy. And we need more studies in epigenetics. Now I'd like to move forward with children. So thanks to, again, the collaborative work that we're doing in the Central Valley and through the NIEHS and EPA Children's Environmental Health Centers, we were able to map children living in Fresno, thanks to UC Berkeley and Fred Lerman at Sonoma Technologies. And with that, we also found that increases in polycyclic aromatic hydrocarbons, naphthalene and phenanthrene in particular, were increased in exposure analysis of children living in the Central Valley in California. And so here's, for example, demographic characteristics of some of these study participants in terms of the children. And again, many of them represent children in socioeconomic status, be able to combat infections and be able to sustain long-term immune health. In addition, we looked at outcomes. We were looking at asthma, but we were also looking at blood pressure outcomes. And we were very interested and intrigued to know that these immune factors and certain inflammatory mediators were correlative with changes in blood pressure. And I think this also talks and speaks strongly about the effect of air pollution and potentially climate change mediated wildfire smoke, that there's increases in cardiovascular symptoms. So given that, we really need to now focus on possible solutions. We understand that air health is very important to all of us at all ages. I've accentuated the issues around pregnancy and childhood today, and that there are issues with wildfire smoke, not necessarily all associated with climate change, but in looking at air pollution and smoke exposure, how can we best monitor this? What are our next steps in terms of research needs about the whole exposome? We call the meta exposome, with lifestyle, behavior, diet, occupational issues, as well as analysis. This is all going to be important in the future when we look at those issues around climate change and other factors on our Earth and where we live, for being able to assess all these exposures for any one individual. So looking at the research effects of solutions and mitigation and adaptation to climate change, for example, looking at multiple exposure in any one individual, looking at composite markers that we can look at over time. And then also we need to study longitudinal exposures over the course of a lifespan, especially in those vulnerable populations. And so we look at solutions-facing research for policy-oriented outcomes. You can see, for example, for cardiovascular, of which I've shown one example with blood pressure changes in children, that we can actually look at research in the population level and individual levels, and that can help us define targets and help us define policy and advocate for policies to reduce exposures. We need more action. We need more research around that action, and looking at the new IPCC report, knowing that the time is now. There's an urgent sense of being able to look as researchers to be able to help and educate more about climate change, and especially where we are with being able to study vulnerable populations. I want to end with some hope and promise, however, and studying those types of interventions and implementation science is critical as we think about how to study that as researchers. Here's, for example, an article that was published in 2015 in which a change in ultra-low diesel use in the vehicles. And with that work that Dr. Balmes and our group had done, shown, for example, that certain exposures of polycyclic aromatic hydrocarbons, which are associated with partially combusted diesel exhaust, were associated with the numbers of methylated CpG islands in their immune system. And with that, we were able to bring that to City Council, as well as many other factors that were occurring at the same time in California, and over time be able to really push and advocate for a zero-emission bus rollout plan for the city of Fresno and other cities around that area. So it takes time, it takes energy, it takes being able to reflect on educating the community, as well as working closely with the community to help them affect change. And so we're really happy about these types of solution-oriented research. We need more research around cost-effectiveness modeling and case studies. This is a great example where a co-benefit of the children's health of the U.S. regional greenhouse gas initiatives were able to show cost savings with changes in policies. And then finally, we need to really think about, from individual level to policy level and global level, thinking about what change in values need to educate early in life, from shareholder to stakeholder. We're all in this together. There's a call for emergency action now. We know climate change is here. Now the next steps are clear. I'm very grateful for being able to talk here at the Keystone Symposium. And here is the community and our group at Stanford. And we are excited to work together to help. Thank you very much.
Hi, my name is John Balmes. I'm at the University of California, San Francisco and Berkeley, but I'm also the physician member of the California Air Resources Board. And I'm going to be talking today wearing my Air Resources Board policy hat. The California Air Resources Board is older than the US EPA and leads California's fight against air pollution and climate change to protect public health. The sources of greenhouse gases in California are shown on this pie chart. And you can see that motor vehicle transportation uses are 40% of the emissions. Electricity generation used to be higher, but we have made major strides over the past 2 decades in increasing electricity generation from renewable sources. The major sources of greenhouse gases and aerosols also contribute to smog and soot that impact public health. California has a climate policy framework shown on this slide, where we have greenhouse gas reduction targets set by legislative and executive order mandate. Legislatively mandated is a scoping plan every 5 years to come up with an actionable plan to achieve the targets. And this leads to regulations and incentives that fund projects such as zero emission trucks and renewable energy infrastructure. So we're currently working on our draft 2022 scoping plan. And the big target is carbon neutrality by 2045. And this year, especially because of the impacts of drought and wildfires, we have a much more robust natural and working lands component to our scoping plan. So an overview of some of the highlights of the scoping plan. A major increase in on-road zero-emission vehicles. Governor Newsom, by executive order, has mandated that all new passenger car sales be zero-emission by 2035. And we have a similar mandate for trucks 2045. We're also trying to decrease natural gas home appliances, and we are trying to increase hydrogen supply in a big way to provide for heavy-duty trucks, which will be run by fuel cell. And we will continue to increase wind and solar power generation. And this is going to lead to a major decrease in both oil and natural gas use. And hopefully we'll also be able to decrease methane emissions from agriculture. These reduced greenhouse gas emissions will also have significant air quality benefits. Major reduction in oxides of nitrogen, PM 2.5, ozone, and we have a much more robust health analysis in this year's scoping plan. And we are aware of health disparities and are trying to protect our most disadvantaged communities as much as possible by reducing fossil fuel consumption in those communities. And that's mainly by reducing diesel transportation. And in summary, we're trying to reduce vehicle miles traveled in motor vehicles and increase active commuting, which has positive health benefits, decrease wildfire smoke by better management of our forests, and this will lead to decreased mortality, ER visits, cardiopulmonary healthcare utilization, diabetes, infectious diseases, and adverse birth outcomes. So improve children's health and quality of life and life expectancy. Thank you.
Thanks everyone for those excellent presentations. I think I'd like to kick off the Q&A, and I'm gonna start by asking some questions that were stimulated by your presentations. And I think what I'll do is I'll pick on a person, but I'll encourage others to chime in after the initial response. First, Susan, I was really intrigued by your comments about the health benefits of climate action, and I was wondering if you could explain a little bit more about how that works, and also whether there are strategies that maybe cities or countries are taking to solve both air pollution and climate problems sort of simultaneously. I think in the past, those two kinds of strategies have been somewhat separate. And if you could talk about maybe innovative ways that we're now pushing to try to coordinate that kind of policy action, that'd be really helpful. Thanks. Go ahead.
Absolutely. And I was glad to see that several of the speakers talked about this area of multiple benefits of reducing fossil fuel combustion. And it is true that if we move away from burning fossil fuels, we will achieve multiple benefits. Most obviously, I would say, from reduced greenhouse gases and reduced air pollution. But the mode of action also plays a really important role. So if you can imagine, reducing fossil fuel combustion in the transportation sector, you can do that by implementing emission standards on tailpipes. And that would be very effective and has been very effective at reducing air pollution from the emission stream. And so we improve air quality, but people are still sedentary and riding in personal vehicles and still sitting in traffic and getting disgruntled on the road. If we were instead to displace personal vehicle ridership with active mobility, cycling and walking and running in a safe and equitable way, we reduce greenhouse gases, we reduce air pollutants from the combustion of gasoline or diesel in the vehicle, and we also improve physical fitness and mental health. And so that's just one example in the transportation sector, but there are many other examples of methods of achieving co-benefits in terms of improving diet, more nutritious diets that are also low carbon. The list sort of goes on. I think the point that I was trying to make also is that these co-benefits can occur locally and immediately. And so they provide a really strong motivation for undertaking some of these actions that provide co-benefits, whereas the climate benefits are global and diffuse and occur over many decades.
Thanks, Susan. Are there others that would like to add to that?
I would, Patrick. I tried to make the point that in California, we have an integrated policy to both improve air quality while we're decreasing greenhouse gas emissions. And we didn't used to do that. It used to be siloed, but we definitely consider both. And we can control some things at the state level, but we work closely with our local air districts because the state controls mobile sources, while the local air districts control stationary sources.
That's interesting, that policy divide. Yeah, I think it's maybe of interest to emphasize this point that controlling air pollution and controlling climate, climate active pollutants are not necessarily the same thing. Although with an effort, the two can be coordinated. And as evidence of that, in the United States, as I mentioned in my intro, over the last 50 years, we've been really successful, especially in California, at reducing air pollution levels and improving air quality. But we haven't really, we haven't done much on the carbon dioxide emissions. But I'm really encouraged now to see that California is now trying to tackle the carbon problem as well as the air pollution problem that they've been so successful at. And I think other cities and countries around the world can sort of take those examples and try to apply them in their own local setting. I'd like to.
Something to that, maybe.
Yeah, sure, go for it.
Yeah, so there's things happening kind of statewide. There's also a lot of actions that are happening in the hospitals and in the universities. In fact, the University of California recently held a memorial, which was basically a vote across all 10 University of California campuses, and setting goals for the university. And that those goals not be simply carbon neutral. This idea that various businesses and this cap and trade sort of sometimes some of that has been a lot of sort of bogus things where they put.
Everybody, I just wanted to interject, and sorry to interrupt. We're having a little bit of trouble with your audio, and it might be helpful to rejoin, or else fiddle with your microphone. There's something loose about it. It sounded like it was coming on and off. While we're actually, I was going to pose the next question to you, so let me skip, and we'll come back to wildfires. I'd like to move on to Kari. That was a really stimulating presentation about some of the mechanistic issues that are relevant to immunology and children's health. I'm wondering if there are any insights from that kind of research about possible mechanisms in which we could understand how air pollution and other climate factors like extreme temperatures could interact sort of biologically. Is there any emerging insight from your field of research to understand how interactions might occur at the molecular level among different kinds of climate stressors?
That's a great question, Dr. Kinney, because we have to be inspired by what's happening around us. And for those individuals that are undergoing a climate event, most people are at any one time. And during many items, for example, heat stress plus drought plus potentially a wildfire. And so what we're doing is looking at the immune system as kind of a reflection for how people can be exposed multiply. And there are markers in our immune system that we can detect. And so with heat stress, there are certain markers that get upregulated, and those are different from those markers that get upregulated with pollution. And so we can look at the combination in any one individual and see to the extent by which heat stress plus pollution affects their immunity. And for our preliminary data, we are showing that with heat stress and pollution, that affects the immune system even more, so that you might not be able to respond to infections, or you might get enough what we call inflammation to induce asthma or to worsen your autoimmune disease and diabetes. So this question is a very critical one as we continue to really make sure that our research reflects the people's needs and reflects what's happening out there in the world, which are multiple exposures in any one individual. And then we're going to look at that over the lifetime. But it's an excellent question. But we do have markers to look at this, and that's good because now we can follow it.
I'm glad to hear that progress is being made. Others want to weigh in on that point?
Well, just to point out that currently in Europe, where there's an unprecedented heat wave, that a number of the deaths that have occurred are attributable to air pollution as well as heat. It's the interaction. It's been studied in previous heat waves, and it's currently happening again now.
Yeah, that's a good point, John. And I know I've seen some recent epidemiologic evidence. In fact, I think reviewing a paper recently for a journal that you're an editor of that shows a strong interaction epidemiologically between temperature and air pollution. And I think that's, so we have these, as Kari was mentioning, sort of micro to macro, we have these different levels of evidence that are converging on some of these questions. And I think that this interaction issue is really important one because unfortunately, extreme events don't always occur one by one. They often, are compounding. Heat waves that are prolonged, cause dry conditions, which make wildfires more likely. And so people are being hit by multiple stressors. I remember a few years ago when Hurricane Sandy hit the northeastern United States. The hurricane came, it was flooding, there was electrical outages, transportation problems. Meanwhile, right afterwards, and there was a cold snap. So people were, getting really cold and they couldn't heat their homes. They started using generators, producing carbon monoxide, which could, unfortunately kill some people when the carbon monoxide gets indoors. So I think this interaction question is going to be more and more important. And I'm glad to hear that there's evidence emerging, from a variety of disciplines on that. So Irv, I'm going to test your microphone here by asking you to say a little bit more from the wildfire perspective. In contrast to anthropogenic air pollution, which, as I said, we have tools for controlling it. What are the policy options that are available to address health risks from wildfires? How do you think about that problem? You're silent.
There we go. Okay. So, yes.
Speak up a little bit. Maybe we'll hear better. Maybe get closer to the mic, possibly. Or
can you hear me better now? No. No, I can't hear you.
Sorry. Let's try. Go ahead.
Hello. Hello. Can you hear me? Can you hear me?
Okay. Yes.
Okay. So the question was, what can we do?
About Paul, how do we solve this problem of wildfires? It's the policy levers seem quite different than what we have for anthropogenic air pollution.
Okay, well maybe I'll run that question a little bit just to say that there are things people can do.
We're going to need to sorry, Erba, we're going to need to ask you to probably switch out your microphone. I don't know if you were on the headphones before. You want to try it without them? No, we're not hearing you at all. Any suggestions from the technical folks?
I can jump in to answer that question while we're waiting for Irvin.
If you would, John, why don't you? And then we'll see if we can solve Irvin's problem.
Yes, I've been pretty involved in the wildfire space for a long time. And what we have to do is better forest management. And we're trying to step up in California to do that. But it's going to take a lot of money and a lot of time, because with the legacy of fire suppression over decades, we've built up a lot of fuel that needs to be cleared out. We can clear out some mechanically, and we can use prescribed burns to clean out other aspects of this legacy of fire suppression. But it's really forest management that will reduce the risk of catastrophic wildfires. The other thing is that we have to stop development at the wildland-urban interface. The mega fires, Irvis showed the Camp Fire, which destroyed the town of Paradise. Other towns have been destroyed in California since then. We, as a society, we can no longer really afford to develop in wildfire prone areas. And then for the communities that are already there, resilience has to be developed. And that means defensible zones around houses, around the entire town, increased use of sensors to pick up fire early so that there can be quick strikes. It's a major effort. And while California has increased funding and increased collaboration with the U.S. Forest Service in terms of prescribed burns, we still have a long way to go to better manage our forests.
That's very interesting, John. In the area of prescribed burns, is there any worry about the air pollution that's going to be generated from that sort of on an ongoing basis?
Well, I'll start off, but Kari can yeah, I'll switch over to Kari. I've been talking too much. She knows this.
Oh, no, it's great that everyone's here. And of course, we're talking about wildfires today, but importantly, this is all within the spectrum of extreme events and climate change and air pollution, and how to prevent and to be able to mitigate and use renewable energy sources and also adapt. And so within the adaptation, as well as mitigating to wildfires, we think that by using prescribed burns, which have been used very beneficially for centuries to be able to reduce the fuel at the bottom of the forest, we can try to decrease the risk of these severe, rampant wildfires that have weather patterns in and of themselves and create soot in the air and increase warming. And then unfortunately, our wildfires, at least in the West, are increasing air pollution so much that the improvements we've made in other regulations are now unfortunately being overcome by the CO2 emissions in the air to the wildfires. So this is really a critical problem, not just for us. There are no boundaries with wildfire smoke. Our wildfire smoke, for example, last year, the first people to pick it up were people in Boston. So it's really important to know these winds can circumnavigate the world. So using ways to mitigate wildfires and prescribe burns are one of many ways to be able to think about this. And so we've done studies in communities that have undergone prescribed burns. And when people have a community in which they need to use a prescribed burn and the Forest Service is using it, they will let the community know ahead of time. And so with that, you have the ability to decrease any health risk due to the smoke. And importantly, the smoke is minimum so that there aren't major health risks. We've studied this and we've published on it. And then finally, people could also say, well, what if controlled burns get out of control? And a lot of that has to do with resources, people on the ground, the right amount of firefighting technology, education, and firefighters. And so we know that throughout the world, we need to keep educating and making sure that we have the right amount of people on the ground to work with controlled fires, because the concept is an important one. And the execution is equally important to make sure that we help enable controlled burns do the right thing and help our forests decrease the risk of wildfires.
That's super interesting, Kari. Thank you for that. And you know, as you were talking, I was thinking about it. it seems like the good one really nice thing about prescribed fires is that we have the opportunity to pick the time and weather conditions under which the fires are done, and as opposed to sort of waiting for a random wildfire to occur, which, as you said, is going to be a much larger fire, but also, the wind might be blowing in the wrong direction, so I think it really does make sense that from a risk management point of view to go that route. Erva, let's give it a try. Try again.
Can you hear me now?
That was good. Speak up like that. I think that'll overcome the static.
Yeah, I just wanted to add
Around the fires, and I mentioned this in my
pre-recorded session that
the
and the using fire to fight fire has actually
been very well proven, and
there's been a couple of fires recently that the giant sequoias, which are trees, groves of trees that are
thousands of years old, were
very recently, and there was one grove that survived extremely well, and it
turned out that was a grove that in the they had instituted
exactly the sort of indigenous practices around that grove in terms of clearing out the
low vegetation and so forth, and
survived really well, but some of the others that
never had that, not in the last 150 years. Approach to firefighting control implemented were
a few of those ancient trees, so it does work, and that was
50 years ago
was applied.
So Erva, thank you, and we could hear very clearly part of what you said, and other parts were a little bit muffled. But I think if I understood correctly, you were pointing out this experience recently in California, where there are some historically really important giant sequoia groves, these trees that have been around for hundreds or thousands of years, that were at risk. But it apparently the places where the historical or indigenous kind of processes for fire control were implemented fared better, if I understood correctly. Does that sound right, John? Okay, cool. And on this, I'd like to stay on the wildfire question for just another second here, and maybe turn it over to Kari, and John, you can weigh in as well, about the question I think that Erva raised regarding the comparative health impacts of wildfire smoke, sort of the PM particulate matter that's in wildfire smoke. Is it qualitatively different in terms of its health impacts, and especially at the mechanistic level, compared to the kind of particulate matter that we know more about from our previous studies, which is from fossil fuel burning? What do we know? What's emerging about that question? That's for Kari to start, and then John can take over. And Kari, I'm not hearing.
Kari was muted.
Thanks so much. So I'll try to answer, and then John can also please feel free to weigh in. I think there is a lot more that we know about wildfire smoke, in particular compared to, let's say, diesel exhaust emissions. Importantly is when we think about wildfire, it's not so wild anymore. It's not just burning up trees. There's a lot of land use issues, and people's residences and commercial buildings, unfortunately, are going into flames. And so what we see, for example, in our chemical determination of wildfire smoke, as well as many others, they have actually published this recently, but there are microplastics, there are heavy metals, toxic metals, there are other detergents. For example, your paint thinners are going up in the air. Detergents that you use, shampoos, are all getting evaporated and going into a gas phase, and so they go up into the air. And unfortunately, these smoke particles are in different shapes and sizes and different charges, and so some actually go up in the plumes, some go horizontally within the plumes. Some, unfortunately, wildfire smoke, as it moves across the nation, for example, the UV light can then change those chemicals into different chemicals. And so just because it's been some days since a wildfire doesn't necessarily mean it's safer. It actually could mean that the toxicity has increased. And there are other factors involved in the overall composition of a wildfire, smoke and its emissions. But the other thing I want to make sure the community knows is it's not just about the wildfire smoke and that we can feel, but there are other ultrafine particles and volatile organic compounds in smoke, just like there are diesel exhaust. So there are a lot of similarities, but unfortunately, wildfire smoke in general can have more toxicity. But the other problem with wildfire smoke is when people return to their communities, they've evacuated, they might have been able to go to a place where they feel safer and are safer from the imminent danger of wildfire. But then when they go back to the communities, a lot of that soot has then moved down by gravity and is on the ground or is on the play structure. And so, or it could be in the water supply. And so there are very important methodologies by which when you have a community come back into their house of residence that need to occur so that that toxicity of the wildfire over time is not increased. So it's a little different than air pollution in terms of the timing and how we need to make sure we can improve the health and prevent health effects due to wildfire smoke. And I'll hand it over to John now because I think he also knows a lot about this. Thank you.
Yeah, thanks, Kari. There's actually a fair amount of controversy in the epidemiologic literature about the relative toxicity of wildfire smoke PM 2.5 versus other types of PM 2.5. There are folks who feel that on terms of cardiovascular effects in adults, that the biomass smoke, and which wildfire is a form of, is less toxic. PM 2.5 in that smoke is less toxic than like diesel exhaust particulate. On the other hand, there are data that have come from investigators at the Scripps Institute, Southern California, that have shown pretty convincingly that with regard to children's lung health, that wildfire-specific PM 2.5 is actually 10 times more toxic in terms of causing increased healthcare utilization than the usual type of PM 2.5 from power generation and motor vehicles. So it's an active area of research. I think the toxicology needs to catch up with the epidemiology, to be perfectly honest. My personal feeling is that the respiratory toxicity of wildfire smoke PM 2.5 is pretty well established. Almost every study shows increases in asthma and COPD healthcare utilization, and there's increasing evidence about cardiovascular disease healthcare utilization. But I think, again, we need to have better toxicology to determine the relative toxicity of these types of particles. But Kari's point about the fact that wildfire smoke is no longer just biomass smoke is really key. There's a whole National Academy's effort to define the chemistry of the wildland urban interface fires. There's a reason that structural firefighters wear Scott air packs, self-contained breathing apparatus, because when anthropogenic materials burn, it's very toxic. And so when we have a mixture in these big mega fires of both biomass and man-made materials burning, it can be quite toxic.
Thanks, John. And let me ask you to take off your science hat and put back on your policy hat for a second, and tell me how a regulatory body like the Air Resources Board or the US EPA should think about setting standards for PM when it turns out that wildfires become the dominant source of extremes. Like, are the standards still fine based on all the other epidemiologic evidence, or do we need to rethink them?
That's an excellent question, Pat. And I caused a little bit of controversy. I was on the recent PM 2.5 review panel for the Clean Air Scientific Advisory Committee for the US EPA, and I suggested that wildfire events be considered for regulatory purposes. So right now, a local air district has a pass whenever there's a wildfire because it's supposed to be, a natural occurrence that they don't have control over. But as I think both Irva and Kari have pointed out, they're not entirely natural anymore. When a PG&E power line causes a campfire like we had that took out the town of Paradise, it's not just a natural event. And so I think that setting a safe level shouldn't necessarily change with regard to PM 2.5 when we have wildfire episodes, but the policy levers that can be pulled when there are these events causing major changes in air quality, those policy levers can be, pulled. And, I mentioned the resources that are necessary for forest management that Kari and Irva have also mentioned. I think that we should push, when we have poor air quality due to wildfires, we should push for greater resources to be applied in that air district to control of sources of wildfires. And also, there could be greater resources put into to reduce exposure. People are talking about having HEPA filtration devices, air cleaners, be an essential appliance for those of us living in Northern California, for example. So I think there are many things that we can do, and I think we need to move from considering wildfires as a natural event that we don't have any control over to something we need to do something about.
Yeah, excellent point. I'm going to turn the questioning back over to Susan, who unfortunately has been on the sidelines for a few minutes, but I know you've done work on wildfires, so that's if you'd like to add anything on that point would be fine. But I also thought we might zoom out to more of a global scale, because we've been talking a lot about California and some very specific places, but I know that a lot of your work, Susan, is working with cities around the world, and I was wondering what experience you're having in that context with air quality and climate sort of co-controls and sort of where that work's going.
Thanks, Pat. Yeah, I was going to add about on the wildfire issue. I think it's an important question that we're talking about here in terms of comparing wildfire smoke to sort of other forms of combustion particles. But I do want to make the point that those other forms of combustion particles, that sort of general PM mass, is also changing simultaneously, because wildfires are becoming more and more an increasing source of PM 2.5, not just for people in the West, but across the entire country. So, I think Kari mentioned this as well, but we are expecting more and more, a greater and greater fraction of total PM 2.5 to come from wildfires. And that will make it harder for us to attain our national ambient air quality standards, especially if we tighten those standards, which we need to do to be protective of public health. The current World Health Organization guideline is substantially lower and more stringent than the US EPA National Ambient Air Quality Standard for annual average PM 2.5. So I think we also need to be considering the changing face of the, quote unquote, general PM 2.5 mass, that it's not how it was 10 years ago. It's not how it was 20 years ago. It has a different composition now. So when we make these comparisons, we also have to be cognizant of that. But Pat, to your other point about cities around the world and how they can address this issue, I think this relates because, cities are home to about 80% of the US population, about 50% of the global population, and we're expecting that to rise globally to about 2/3 by 2050. So cities are also responsible for about 3/4 of greenhouse gas emissions. So they're very, very important when it comes to climate mitigation. And they're very important when we think about the co-benefits, the health and air quality co-benefits of greenhouse gas mitigation, because those co-benefits would be experienced locally. And yet cities are not completely out of control of their PM 2.5 concentrations, but it's very difficult for cities to control their own PM 2.5 concentrations because of the many sources of PM 2.5, many of them coming from outside the city, affected by long-range transport from distant sources, one of which is wildfires. So when we think about the future and urban air quality management, it becomes harder for cities to manage their own air quality as wildfires grow. There are other air pollutants to be considering as well. We also know that tropospheric ozone, ground level ozone, is also transported from distant places. And so it's very important for cities to be working not just within their local government and with their own communities, but also with their national government and be a part of international agreements as well.
Thanks for that, Susan. I wonder, let me ask the organizers if we're about at the point where we should start entertaining audience questions. I had that on my calendar here, but could you confirm that? We have quite a good number of rich questions. I think I'll move in that direction anyway. And let me start by asking a question that was one of the first that was originally posed and got a lot of endorsement from other people on the call. The question is, and this is for really anybody that wants to chime in. As ambient temperatures continue to rise, so too does human reliance on air conditioners, which subsequently adds to greenhouse gases and other air pollutant emissions. How can we address this issue? Who'd like to grab that one?
Well, I'll start off. It's definitely an issue here in California. We've actually mapped the increased energy usage that will be required as the climate gets hotter here in California. And, it's pretty striking, actually, the change in hot days, especially in the Central Valley. For example, our capital, Sacramento, currently just has a few days a year. Irvin knows this because she works not too far away at Davis. There's just a few days a year that are extreme heat days over 104. But by mid-century, it'll be almost 2 months of those days. So how are ag workers, how are construction workers actually going to survive or do their work, without air-conditioned spacesuits? So anyway, we've mapped the energy demands, and they're really high, especially in the Central Valley. So we have to make sure that we are increasing our renewable energy sources to be able to deal with that increased need for electricity. It's not just the air conditioning. We're electrifying all our motor vehicles, cars and trucks. And so it's going to take a huge amount of renewable energy to be able to provide that adaptation.
Yeah, go ahead, Susan.
I was just going to give a similar answer that decarbonizing the electricity sector will help immensely, so that we ensure that the electricity we draw is not adding carbon emissions. But there are also other solutions that admittedly will not work in all situations, but need to be researched and relied on more and more, which is alternative ways of cooling. Ensuring that we are greening cities to increase shade in more places. There are more sustainable and greener ways to cool buildings as well, using water and other techniques. So we need to be researching those and developing those further, and ensuring that they're cost effective so that we can use them in more types of situations in neighborhoods.
Yeah, very good points. Another question that is addressed to Kari's work, really, it talks about the epigenetic methylation changes, and the question is there any evidence or reason to believe that those changes would be carried from generation to the next? For those of us who aren't experts on methylation, maybe you could help kind of provide a little background on whether that's a reasonable question or not.
It's a very reasonable and excellent question. I, among many researchers, study this, and it's for other fields too. And so I like to think of epigenetics in this way, and perhaps it's a little simplistic, but I think it's an important concept and paradigm to work within. So if you think of our DNA, our genetics, as notes on a page, we know that those notes, in terms of musical notes, they can either be played loudly or softly. They can either be played at all or not. There are certain signals on the notes on the page to be able to know if those notes should be played at all or played more or less. And so because of that, that's what I call epigenetics. It's that modification of the DNA to be able to understand, is that DNA going to be made into something to help us or not? And that oftentimes is what we call these methylation chemical changes on our DNA, to either change the DNA so that it's not necessarily going to make a protein that we need for our bodies, or it makes a protein that we don't need for our bodies that could result in a disease. So we've been studying these, and the changes in the DNA are oftentimes mediated by the environment, like pollution or like tobacco smoke, or sometimes diet. So there's beneficial changes in our DNA and there's non-beneficial changes in our DNA. And people have studied whether or not that can get passed on to your children. And my colleague at Columbia University, where Dr. Sorensen works, actually was one of the first ones to show that a woman who was pregnant and smoked, that change in the DNA of that child could actually get transmitted into the next generation. So grandmothers had grandchildren that had the same changes in their DNA because of tobacco smoke, for example. They've also shown that to be apparent with fathers who smoke. So yes, these changes can get transmitted to the next generation, maybe not all of them, and we need to understand it better as to how long it stays in any given family. But on the good side, if people can stop doing a certain behavior, or can get out of a given area of pollution, or we can change policies to use renewable energy so that we can decrease pollution, then that population can benefit and the epigenetic changes can potentially reverse. So that's the epigenetic sort of summary that I'd like to talk about. But to me, we study it as a marker to understand cumulative effects of pollution, and it is a very important marker. And we do need to know that our exposures now could affect children that are currently unborn in the future. And because of that, I think as a society, we need to even more so make sure that we can mitigate and adapt to climate change.
Yeah, very good point about the importance of those outcomes, and sort of raising the profile and the importance of controlling the sources and controlling the exposures. Another question that I think I'll pose to you all is about the role of community-based participatory research in addressing, any of these problems we're talking about, specifically about air pollution and carbon emissions. Does anybody have experience on the panel doing studies at the community level where there's participation from the individuals? And if so, can you give us a little bit of an idea of the lessons learned from that kind of work? And this might be a chance, Irva, for you to speak up if you're able, although I see your camera's gone away, so maybe, but anybody else? John, you want to start?
Well, I can hear her typing, I think. So, Irva, are you there? Well, I've had a little experience with community-based participatory research, and I think so has Kari, but a specific initiative in California, legislatively mandated, that has increased the involvement of communities in air quality and climate change policy. It's called Assembly Bill 617, but it specifically was to address environmental justice issues. And so currently there are 17 communities in California that are low-income communities of color that have been determined to have both health disparities and air pollution exposure disparities. And the state has actually provided funding and support for communities to be involved, working with their local air districts to come up with community air monitoring plans and community emission reduction plans. It's really transformative. there have been bumps in the road, and we're still trying to make sure the implementation achieves the lofty aspirational goals. But I'm very proud of the fact that California now has state policy to address environmental injustice by involving communities in monitoring pollution and coming up with effective strategies to reduce that pollution.
That's an exciting development. Thanks for sharing that, John. Yes, Kari.
Yeah, I think it's critical if we're going to make changes that we must go to the community and ask them what they need first, and ask them, especially Indigenous communities, how did they create improvement of the land and steward the land way before a colonist got there. So really being humble and understanding that the communities have a lot to give in both ways, and capacity building so that communities can have the tools they need to be able to adapt to climate change and mitigate. So a lot of this, the WHO has an academy now to do a lot of work with the communities and receive information from communities. I think the NIH also is doing a lot for community engagement at the grassroots level to make sure that we can hear the community's voice and then change and modify our research accordingly. So I'm really glad that there's more community-based participation. And like John said, really focusing on underserved communities, because those are the hardest hit.
And I'm going to take the chair's prerogative and weigh in with some of my own experience on this question as well. Actually, when I first started my career many years ago, one of the first sets of projects that I got involved with in New York City were ones looking at trying to understand the impact of diesel traffic and diesel pollution on the very high asthma burden that existed in a particular neighborhood, which is called Harlem, and also northern Manhattan. So we actually worked with community groups in New York City in those specific communities to set up air monitoring, sort of low-tech air monitoring campaigns along different road corridors where there were diesel bus and truck routes, or there were diesel bus stations near community resources like hospitals or like junior high schools. And we did I remember one study we did way back in 1996, I think it was, where the high school students who were part of the Earth crew from West Harlem Environmental Action helped us set up monitors around the community, and we showed really strong gradients. Like it was really true that the diesel exhaust pollution was very different depending on which street you were on. And there was no monitoring other than that study. There was no sort of background monitoring going on in that community. And that worked, both from a scientific point of view and also from a community empowerment point of view. Actually, was pretty influential in sort of raising awareness about the importance of diesel pollution in communities. So that kind of work, sort of fast forwarding now to the present time, where now climate change has become much more of a salient issue for us. We're now working at Boston University with communities around Boston who are sort of at the forefront of climate risk, either because of coastal flooding or because of extreme heat events. And we have a project going on in a community called Chelsea, which is a low-income minority community adjacent to Boston, trying to understand the individual exposures to heat, both indoors and outdoors, and how community members can reduce their exposure to heat, and sort of what their perceptions and thoughts about that are. And so we've been working very closely in a kind of both a quantitative but also a qualitative way to try to understand some of the barriers to health improvement in that setting. So I think the community-based participatory research paradigm has been one that's had a long and important history in environmental health, and yeah, so I'm glad that the question was raised by the audience on that one. Urba, do you want, or Susan, go ahead, and then I'm gonna test Urba's mic again. But go ahead, Susan.
Okay, sure. Yeah, I'll just briefly broaden the question out a little bit to also include local decision making within local governments, because this is another community of local decision makers that often are very resource strapped and don't have a lot of data at their fingertips. And luckily on both scales, community scale and local government scale, we have new tools to be able to provide data to inform decision making. We have satellites that are constantly observing our air quality, heat, green space, and other types of environmental exposures. We have new sorts of low-cost sensors that can be distributed across entire cities, or mounted on vehicles and vehicles driven around cities street by street. So we have novel sources of information, and Pat and I have been working with C40 cities along with other stakeholders to try to help cities around the world gain access to that type of information and be able to interpret it in ways that are meaningful to them. So just as one example, cities that are part of C40 develop climate action plans that lay out their pathway to achieving carbon neutrality. And they all have different approaches that they plan to take, and yet very little resources to be able to model things like the air quality benefits that would occur or the public health benefits that would occur. And so I've been very fortunate, along with Pat, to work with some of these cities and help provide some of that information to inform decision making. And one of the lessons learned I can say is that it's really a two-way street. You know, I'm learning just as much from this experience as hopefully the cities are from some of the data and tools that we're providing. And I think we're both improving the level of information we have on both ends. And it's a really rewarding. It's very rewarding on both ends, I guess is what I'm saying, is that the researchers can really learn a lot and improve their methods and tools just as much as the community and local government can gain knowledge in terms of the data to inform their advocacy or decision making.
Yeah, that last point's a really important one, Susan. And that's something I learned a long time ago, is that for these partnerships between academics and community activists to be successful, there really has to be something in it for everybody. You know, there has to, you know, the community needs to get things that the scientists, especially young scientists who are starting their careers, need to get papers and, you know, career advancement. So, but that's entirely possible. You just have to sort of set it up in a way that everybody understands sort of what the goals are, and then they can accomplish their goals in the partnership. So I'm going to see, Irma, do you want to say 2 words, and we'll see if your mic's working, and if it's not, I'll sort of go like that. And what's that? Go you again.
Does this work?
That
Does
was
this
good.
work?
That's good. I'm not sure if it'll stay.
No,
No, it's starting to show static again. Okay, well, you've been doing a great job of typing in lots of good comments into the chat. So I think we'll stick with that because we're getting that static again when you start to talk. I'm gonna. I think we're getting close to the end of our time, but there's a couple of more questions I think we can get to. And one is, one person asked, what are the adverse pregnancy outcomes that the epigenetic changes are related to? And I think you might have alluded to that, Kari, but do you want to say a bit more about that?
Sure. I think the key thing is we can find associations. We can't necessarily say there's a cause or an effect. That really, I rely on my colleagues who do animal models in terms of specific epigenetic changes, but we do know that certain epigenetic changes in animal models in pregnancy can lead to, unfortunately, cancer in the offspring. Those are animal models, however, so we always need to see if those are potentially possible or a framework of humans. But we can say that there are very high associations, very strong associations between certain epigenetic changes in certain parts of our DNA in pregnant women that are associated with outcomes of allergies and asthma in children that are born to those women. And that's both during pregnancy as well as potentially the spouse or the partner, so that the biological partner. So that's important too, to know how instrumental this DNA and how the changes could affect long-term for a child. But then importantly, how does that DNA affect the woman as she moves forward in her life too? So those studies are being done. But yes, there are certain epigenetic changes that are associated with disease in the child if the woman has exposures during pregnancy. I've just given you one example, but there are others as well.
And I guess I would chime in to say that without considering epigenetics, the epidemiology with regard to prenatal exposure to air pollutant, and now there's increasing evidence Did you guys hear me? Okay. I said I would chime in that there's now increasing epidemiologic evidence that prenatal exposures to air pollutants, including now to wildfire smoke PM 2.5, of multiple health outcomes, starting with adverse birth outcomes like low birth weight and preterm birth, but going on to effects on neurodevelopment, as well as asthma and allergy that Kari just mentioned. There's a study that I'm involved with. We showed that prenatal exposure to PM 2.5 among Mexican farm worker offspring affected their IQ at age 10. So, and because wildfire smoke exposures are so high, and we know so little about chronic effects, as Irva said so well, we need to be concerned about these. Since wildfire smoke is so bad year after year in the Mountain West, our kids getting exposed during the wildfire season going to have effects like we've seen with high PM 2.5 and other pollutants from non-wildfire sources.
Very interesting point. I think our time is running to a close. I'm going to make a couple of concluding comments. I was struck throughout the discussion about one thing that I think is characteristic of the climate and health topic in general, which is that it's so multidisciplinary. It's really hard to draw boundaries around the problem. Today we drew the boundary to include lung health and air pollution, but we also talked about green space. We talked about wildfires and lots of adjacent critical issues that impact that simple concept of lung health and air quality. And I think that points out the complexity of this issue. But fortunately, this event is part of a whole series that's actually looking at several of those different aspects. And so I would encourage you to look at the larger series over time. This particular event will be recorded and available on demand as part of the Keystone Symposium's Open Access Masterclass in Climate Health, in collaboration with the Global Consortium for Climate Health and Education at Columbia University. Stay tuned for upcoming ePanels in this Climate and Health series, including the next event that will be on heat, health, and inequity, to be held on September 26th. And hopefully that'll be a chance for some of the other questions about heat to be addressed, maybe to talk more about this air conditioning issue, which I think is really critical, but also the occupational exposures, which are so much harder to control. And also future events will be coming up on infectious disease threats and extreme weather events. So I'd like to thank the speakers and also the audience for joining us today for these important discussions.